Frontline workers over at Stanford staged a protest once they realized that administrative workers and people who are able to work from home had been given the opportunity to get vaccinated before they could. Now, in typical Silicon Valley fashion, they argue, the hospital argues that they relied on an algorithm to decide who would get vaccinated first, which I think is honestly a stupid way to do this. How about let's use logic and human reasoning and do the right thing and make sure we protect the right people. But Stanford Medical Center residents waged this protest on Friday morning, holding signs and demanding answers from Stanford's leadership about why just 7 of the more than 1,300 residents at Stanford were selected to receive the vaccine in the first round of 5,000 doses. ProPublica reported on this and also tweeted that Stanford used an algorithm to decide who got the COVID vaccine first, and the result was only 7 of the 5,000 slots going to residents. The same week, they were asked to volunteer for ICU coverage in anticipation of a surge in COVID-19 cases. So here's an example of what the protests look like. One of the residents holding a sign saying, "I saw 16 COVID patients in the last 24 hours, more than double the amount of residents getting the vaccine." But this isn't really about residents versus residents, okay? This is about administrative and high-ranking physicians who get to work from home or don't have to be on the front lines getting the vaccine before the frontline healthcare workers. Here's a statement from the protesting residents. "Many of us know senior faculty who have worked from home since the pandemic began in March 2020 with no in-person patient responsibilities who were selected for vaccination. In the meantime, we residents and fellows strap on N95 masks for the 10th month of this pandemic without a transparent and clear plan for our protection in place." And so the leadership in the hospital then blamed the algorithm and vowed to reverse the policy. And since the algorithm prioritized people based on age and location or unit they worked in, of course, some of the older administrative employees who get to work from home were prioritized. Again, this wasn't the right way to do it. The frontline workers, the people working in the ICU who have to be in person with COVID patients should have gotten the vaccine first.
Yeah, so 2 great things. One is it can't be said enough how much courage they have. Because I know a lot of people who are really worried about going to the supermarket, even with a mask on and all the different precautions, right? The thing about the people that work at the supermarket, they have to go to work every day inside a closed building and risk their health. They do. It's so hard. And then you think about nurses and doctors. Jesus, for 10 months they have risked their lives for all of us. Look, now let's move to point 2, algorithms. They're not a panacea, funny enough, in this context. So just because something's an algorithm doesn't make it evil. You could put right formula into an algorithm and get a good result. Just because on the other hand, just because it's an algorithm doesn't mean that you don't have to answer for it. Oh no, it's okay, it was an algorithm. Well, what does that mean? What did you put into the algorithm so you got those results out? Just saying something is an algorithm is like saying, well, it's an equation, so it's okay. I don't know what that means. That's not a thing.
Also, let's not forget, algorithms are created by people. Like I think oftentimes when people think of algorithms, they think it's like some magical computed, thing that has nothing to do with human bias. It's people behind algorithms, and there's inherently bias involved in that. And so, look, what happened here is workers stood up and they said, no, we're not gonna stand for this. This is not right, this is unfair. We're risking our lives to keep people alive, and we deserve this protection. And had there not been this kind of protest among residents and frontline workers, I don't think that this would have changed. So I give them a tremendous amount of credit for not only being courageous in what they do in trying to save people's lives, but being courageous in speaking out against their employer in this case to say, no, all of you administrators over at home who don't have to see patients face to face, what you're doing is wrong, and we deserve this vaccine.
Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.